I'm more comfortable in the water than I am on land.
65-year-old Trip Hedrick was born to swim.
The water surrounding you, just for me, is just a wonderful sense of security and peace. It's like getting a liquid hug, so to speak, and then you go underwater and push off, and you just have this silent calm.
A collegiate All-American swimmer turned high school coach and then head men's swimming coach at Iowa State University for 12 years.
We had some extremely memorable meets here in this particular pool.
Hedrick has spent the better part of his life at this pool and many others.
I swim 5 days a week. I lift 2 days a week, and then I do an additional cardio workout twice a week.
He's one of the top contenders in U.S. Masters Swimming, a competitive organization for various adult age groups.
The fly is something that comes very natural for me, and I've had probably most of my success in the butterfly events.
Over the span of 4 decades, Hedrick has set 30 national records and an additional 9 world records.
It seems like my body's built for water sports and not land sports.
But in 2000,
I was 46.
His body was telling him something was wrong.
I was swimming a typical workout, and all of a sudden I had this chest pressure and radiating arm pain. I kind of talked myself out of it being my heart.
After it occurred again a few days later, he called his primary care physician and passed an exercise stress test with flying colors. But the symptoms persisted.
I got hit with a really cold wind and had the chest pain and arm pressure.
Eventually taken to the hospital, doctors confirmed
You've had a heart attack and you have heart disease. And that was really hard to hear.
he had a 99% blockage.
In my left anterior descending artery, which is the widowmaker.
But some patients have just very vague symptoms, a sense of unease, maybe just a little bit of sweating, but nothing that's dramatic.
Hedrick would have the first of 3 stent procedures over the next 15 years to clear his arteries.
I think I thought I was the healthy one. I had this workout regimen. I thought my exercise would keep those veins unclogged.
We think that genetics play a big role in the development of heart disease. Sometimes patients, do everything that they can do. They do everything right, and the disease still progresses.
The competitor in me came out thinking, I can beat this, I can reverse this heart disease, and the fact that I continued to have some issues really bothered me.
In March 2018, less than a year after setting a world record in the 50-meter butterfly,
His exercise capacity had come down, and that was enough to get me worried.
You're going to need bypass surgery.
You don't usually expect to walk into a room and find a patient who looks more physically fit than the doctor is.
despite his appearance, Hedrick's coronary arteries, which feed blood to the heart, were 85% blocked and would require open-heart surgery.
Heart surgery is not a cure. We're basically resetting a clock. Coronary artery bypass surgery is basically plumbing. Our job is to route blood around the blockages.
Feeling great.
2 months after a double bypass,
Never better.
Hedrick returned to the water.
I just told my wife yesterday, my cardiovascular feels great. I'm totally locked in.
And for his doctors at Mayo Clinic, he gave himself a personal challenge.
I said to him, well, I'm so appreciative of what you've done for me. I'm going to promise I'm going to set a world record for you.
I made a promise right back to him that I would be in the audience when he did it.
I want to be the one that tries to defy perceived limitations of what you can do or how fast you can go.
For the Mayo Clinic News Network, I'm Jason Howland.